Aloha guys, Dr. Thomas back once again. Yes, I know you're excited. Okay, we're going to do chapter 10. Chapter 10 is long. It's 32 slides, so it's larger, about twice the size of the other ones for week 4. So we're going to have to move along on this one. On these videos, I have 15 minutes. And I like to put it all in one if I can. Sometimes I can't. Okay, professional ethics and the living. This is actually interesting, guys. Paraphrase, the creed of the American Medical Association stands for practicing American medical technologists. The preamble of the Code of Ethics, American Medical Association. Oh, I'm sorry, this is American Association of Medical Assistants. I'm sorry, guys. Provisions of the Uniform Anatomical Gift Act and the Nuremberg Code. Okay. Explain how the relationship between time, power, and ethics can influence the patient's experience. Identify the problems faced by medical professionals in allocating resources, transplant organs, money, ICU beds, intensive care. Explain the ethics of medical research and experimentation. Explain the need for and the propriety of employment drug testing. Recognize the importance of balancing autonomy and paternalism in patient care. Okay. Professional ethics, American Association of Medical Assistants, Creed. Here it is. They don't tell it here, but you can find it here. American Medical Technologist Standard of Care is at this website. AAMA Creed History. Collectively develop the highest ethical standards of the medical office professional, narrower in scope than principles of medical ethics of the American Medical Association. Of course, that deals with physicians, guys. However, closely aligned with AMA's ethical philosophy. AMT standards of practice. Individuals registered by AMT expect to follow AMT standard of practice, adopted by AMT. American Medical Technologists, it's the Board of Directors, defines the ethical behavior healthcare. AMA standards of conduct for physicians, dedicated to providing competent medical service with compassion and respect, deal honestly with patients and colleagues, expose those deficit in character or competence, or who engage in fraud or deception, respect the law, respect the rights of patients, of colleagues, and of other healthcare professionals, safeguard patient confidences within the constraints of the law. Ethical issue, time, 1 of 2. Healthcare professionals prefer their weekends and evenings free. Yeah, they work in a hospital or something, though, they may not have. Healthcare professionals are forced to use their facilities and equipment more efficiently. Includes weekends, evening hours. Who must work on evenings and weekends? Answer to all these questions lies with the employee with the most power. Is it ethical to base these decisions on status within the organization? Yeah. But I don't entirely agree with this, guys, because it depends on the type of practice of medicine that's practiced. You know, if you work for an ophthalmologist, an eye doctor, they have 9 to 5 or 8 to whatever, hours, and they may be on call. The doctor may be on call or afterwards for in case of an eye emergency or something, but generally so. And of course, if you work in emergency medicine at the ER, well, you know that you're going to be working all sorts of hours. So, okay, moving along. Time 2, time, power, and ethics, evident in the office or the clinic waiting room. Powerful people do not wait. Example: presidents, movie stars, wealthy. Well, yeah, nowadays they have concierge medicine where these people often have a doctor that's on call for them and 2 or 3 other rich dudes, and they pay for that service. They pay a lot. Problems: seek medical care abroad, less money in the U.S. healthcare system. Why do some people do that, guys? To be honest, because American medicine, quality is good, but it's so expensive. There's people that go to Spain, for example, to have a heart bypass and save enough money to spend 6 months over and take a vacation, and it still costs less than it does to have the procedure done in the United States. Ethical issue: allocation of resources, equal change at healthcare regardless of ability to pay. Change at healthcare. I think it should say chance. Okay. Healthcare costs in the United States today almost 18%. That's of the gross national product. Healthcare, as we said before, and all the associated aspects of it, is the biggest business in the United States by almost 20% by 2020. What about 2021? Yeah, it's in my opinion, guys, I've been a long time. It's too much of a business, but because Walker here thinks that, that's probably not going to make much difference. What's the difference of quality of life? Patients are pushed into more than they want by the medical system. The country's turned to the concept of managed care. When the insurance industry introduced managed care, guys, they made it really hard on the doctors and stuff. And a few years later, I got out of it just for that reason. More than 90% of the population with insurance is enrolled in some form of managed care. Problems: healthcare is provided around incentives, encourage practice of cost-effective medicine, minimize variation in clinical practice patterns. People go without insurance. Yeah, it's brought on a lot of problems. Why? Because they don't pay what they once paid. Now, guys, I'm not saying they're paying $1,000 an appointment to come in and see Dr. Tom as a chiropractor. I'm saying where they used to pay $80, and that's with doing physical therapy and spending a half an hour with the patient and all, to paying $14.06. But such a poor amount you can't make a living on it. And after a $3,000 deductible has been met for the year. Okay, moving along quickly. Transplants. With the technology, guys, now that to allow us to organ transplant, it's brought on a lot of ethical dilemmas because there's a shortage of organs out there. 3 categories of medical transplants: autograft, transplantation of a person's own tissue from one part of the body to another, like if you got a burn, add to a skin graft. Homograft, transport from one person to another. Heterograft, transplant from animal tissue into a human. Okay. Transplant history: corneal transplants from dead donors in 1940 or the eye. Kidney transplants in 54, which are common today. Liver and lung transplants 64. Heart transplants with a chimpanzee's heart. I didn't know that. 64. Whole face transplants 2005. Uterus transplants. I didn't know they could do that now. 2016. Blood transfusion, most common transplant type. That's been going on for a long time. Blood transfusions, guys, are quite complicated, and they're a lot more than you see in movies and TV, where they take a tube and they jam it in one person and run over to another one. And they can do that in an emergency, like in wartime and that kind of thing, but it's quite complicated. Ethical issue: transplants 3. Other issues: using live donors, inflicting pain on one person for another's benefit, organ demand increase. Selling organs is illegal in the United States. I have long stated, guys, that in my opinion it should be legal. Now, obviously, the person has to be an adult. You can't be a kid and say, I'm going to sell my kidney. But if an adult wants to sell a kidney, they find someone who wants to buy it, and everything checks out and all, my personal opinion is they should be able to do it. But that's considered a big time no-no ethically. So I think it's possible. I believe it's okay in other countries. Uniform Anatomical Gift Act, 1968. Any individual of sound mind, 18 years of age or more, may give any or all part of their body. Oh, you can give it away, but you can't sell it to make some money. In the absence of a gift by the deceased, and of any objection by the deceased, his or her relatives in a stated order of priority, spouse, adult, children, parents, and in that order, have the power to give the body or any of its contents. You know, I have it on driver's license where you're an organ donor. Anatomical Gift Act, second part. The recipients of a gift are restricted to hospitals, doctors, medical and dental schools, universities, tissue banks, and specified individual in need of treatment. A gift may be made by will or by card or other document. A gift may be by a relative, may be made by a document or by telegraph, or etc. A gift may be revoked at any time. A donor may accept or reject a gift. A donee. So you can't sell it, but you can give it away. I really don't see, guys, why there's a problem with that, but I guess, maybe some dude whose health wasn't too bad would sell off one of their kidneys, but, so what? That's their issue. I don't know. Okay, what is an adequate level of health care? Problems: cost. For example, on the one hand, it's costly to fund transplant operations. Oh, yeah. On the other, costly to fund school lunch programs for indigent, undernourished children. Yeah. Values become involved. There's a waiting list, guys, for many of these organs, and I don't know much about this, but I think there are instances where wealthy people kind of get bumped up higher on the list. Artificial heart may bring 4 years of extended life to each of the 25,000 persons annually at a cost of some $100,000 per life extended. The appeal of artificial heart is it rescues people from certain death. Now, I don't know if they're still doing. I mean, this is not a heart transplant. This is an artificial heart. Are they still doing that? I mean, they experimented with it. I don't know. Makes it sound like they are. The school lunch program might ensure the improved physical development of hundreds of thousands of children for this same amount of money, see. enabling each to live healthier for 60 years or more. The school lunch program does not provide the same level of excitement or emotional appeal. You know, and I've written a book. I self-published it called Bitter Pill. It's critical of medicine. I talk about how dramatic it is to dash out with a heart and a bucket of ice and jump into a private jet and streak across the country with it. You know, but some poor indigent kids getting fed. That's not very exciting. You know, it's sad. Because society does not have unlimited funds for healthcare, ethical choices like this have to be made. Medical tourism. I touched on that a moment ago. Concerns about cost and allocation of resources result in medical tourism. Patients travel away from home solely for medical care, priced lower, otherwise not available locally. I've been in Mexico and met people going to the dentist down there in Tijuana. And the reason is, guys, again, it's so darned expensive in the United States. If you need a bunch of implants and stuff, it's tens of thousands of dollars. When there are competent and skilled dentists working there, that you can get it for maybe 25% of that cost or 10% of it. So, do I blame them? No, man, I'd be doing it too. Yeah, of course, I'd be careful who I went to. All right, intensive care, ICUs. Now, guys, this is in the news right now because it's such a huge issue with the COVID virus. People aren't getting the vaccines. They're not wearing masks. They're not practicing what they're supposed to be. They get sick. They clog up and take up all the ICU beds. Who gets a bed? An elderly person or a young person? A limited prognosis patient or a good prognosis patient? Prognosis is the likelihood you're going to get well. A paying patient or a non-paying patient? A family man with 5 dependents or a bachelor with no responsibilities? Why is this an issue? Well, there's an ICU shortage, especially right now. This is huge. ICU surplus may cause staff maintain patients to increase ICU, may cause the physician to identify workload reduction. Use of ICU is just one example of day-to-day ethical judgments. If there's a shortage, people don't stay as long. Why? They got to hustle them out of there. If there's a lot of them sitting empty, they might work to kind of keep people in there a little bit longer. See what they're saying, guys? These things happen. Ethical issues in medical research. In the past, National Commission for the Protection of Human Subject, of Biomedical and Behavioral Research. Purpose, review protection rights of subjects involved. Federal sponsored research. Guys, when you get a chance, look up this Tuskegee study. They did a study of African American men with syphilis. Syphilis can be fatal. It's what killed Al Capone, famous gangster. So it's not to be fooled with. And they studied these poor guys for years and years and knew they had syphilis. They were a government agency just to see what would happen to them, man. Yes, look it up. This is a famous, infamous thing. Terrible. Went up into the 70s. National experiment was in Alabama, of course. Opposition to national research. Some argue therapeutic medicine is inescapably experimental. Nuremberg Code. Nazi Germany, where the Nazis did these horrible experiments on these people. Guidelines developed as a result of medical atrocities like the Nazis. Private office experiments. Increasing private participation. Why? To make money, man. Make money. It's always about money. It's about money. Cost of developing new drugs. Federal regulations require better gender and ethnic representation. Conflict of interest, best interest of the patient. Pharmaceutical demands for protocol fulfillment. Benefits, adding a level of continuity. Personal contact, providing pool research subjects. Scientific. They're constantly looking for new drugs, guys, because they start losing the patents on the ones that are out there. And the effort is towards the ones that sell the most. Public screening of medical reasons. I'm going to hurry. Examples: hypertension, cervical cancer, diabetes, armed service, mass screening for antibodies to HIV. Results contribute to medical research, identify latent diseases, justify the infringement of our privacy. Drug testing. Damage associated with drug testing. Invasion of privacy, breathalyzer test. Damage alleges drunk driving. Inherent problems, improper calibration, untrained personnel, time spent between ingestion testing. Broken machines, false positive tests. Psychological testing for employment. To assess personality traits, to determine who will perform a given job well. Generally screen all patients. Access random lie detector. Lie detector has not been shown to be accurate enough to be used in court after employment. Athletes, fairness random. Cystic fibrosis. All right, guys, you got to finish this up yourself. That's the end of it. Dr. Tom signing off.